Lindsay, thank you so much. Lindsay will be helping me manage it all. So we are recording. I'm going to go ahead and begin sharing my screen. Here we go. And wait, no, wrong thing. Okay. That's not what I want. Y'all bear with me for a minute while Naomi is having technical difficulties. Um, Lindsay, I'm sharing a whiteboard and that's not what we're
Yes.
supposed to be seeing.
Yeah, if you go to share screen and find your screen.
I must have clicked on the wrong thing. What is happening?
Oh,
I'm
I
not
did
doing
that.
that.
That's me. I was just clicking away. So sorry. Now you can share.
Happy Friday. Is it April 1st? What is happening? Oh, happy Friday. Welcome, everyone. As you are coming into the room, if you would introduce yourself in the chat, if you would just drop your name, where you're joining from, you can include your title, as well as have you ever ridden a wild animal? And if so, what animal was it? Welcome to the last Friday of the month. Welcome to PFCC Partners Community of Practice Workshop. We are recording, and there will be a live transcript available. If you have not already subscribed to the PFCC Partners YouTube channel, please do so. And you can see not only today's presentation, but you will also be able to see past presentations as well. I know many of you are familiar with PFCC Partners, but just in case some of you are not, I will not read our mission, vision, and values. So just know that this is what we are all about. We're all about transforming healthcare into making it an inclusive and improving the healthcare by having patients and families involved through all aspects of their healthcare journey. And we know that healthcare is a complex system. The systems are difficult to navigate and they're even harder to change. And that's where working together comes into play. So one of the ways that we do that is by opening and creating that space within the system for patients and family care partners to drive the improvement. We are wanting and looking for a system that centers care and care processes on the person. So there's potential to reduce the complexity and advance a culturally humble and equitable healthcare system. And one of the ways that we do that is through our PFA network. The PFA network fills the space with impactful people, stories, and insights. It's a network that was created by patients and family members for patients and family members. Through the PFA network, there is the opportunity for skill building and skills exchange, networking through our community forums, as well as engagement opportunities, not just with others with lived experiences, but with other organizations as well. So having a seat at the table. I am so excited to bring to you all today's presentation, Building the Table Together, Lessons on Authentic Community Engagement from Inspire. This is a project that comprises of 4 national organizations working together. And we have Evelyn Kane with Camden Coalition. She's the Associate Director of Community Engagement and Capacity Building, as well as Savvy Makalena. Did I say it right, Savvy? Okay, she's not telling me no, so I think I got it right. And
It's
if I
okay.
didn't, I apologize. I
My
tried.
father always said, you can call me anything, just don't call me late for dinner.
I try. Tell us, please say it, pronounce your last name again, because I try to get it right and I forget.
Makalena.
Makalena. Thank you. I try and I forget, but I will not forget this time. Savvy Makalena, who is the CEO and founder of Give Me a Break. Savvy is actually joining us from Hawaii. So thank you. I know there's a time difference there as well. So without further ado, I'm going to stop sharing my screen and pass it over to Eveline, who can only introduce her and Savvy as only she can.
Yeah, thank you so much, Naomi. It's so exciting to be here with you all. I see lots of familiar and friendly faces. So let's see, I'm going to try to share my screen. Folks can see that okay? Excellent. All right.
Yes.
Perfect. And shout out to Naomi for pronouncing my first name correctly, which is like an extremely rare pleasure in my life. So thank you for that. We are so excited to be with you here today and talk a little bit about the Inspire Project, which is a project to advance how community engagement happens in healthcare. And the title of this presentation is Building the Table Together. And this comes from there's, I think a common refrain when we talk about community engagement work. Lots of folks will say, think about like who's at the table with you, are there seats at the table? And a few years ago, I was in conversation with some folks with lived experience that we do work with, and this phrase came up. And someone said to me, it's great to be at the table, it's better than not. But really what we should be endeavoring for is to think about who we're building the table with. Because at the point that we're just thinking about who's at the table is there, the number of seats have been determined, we're creating pathways for who's invited. But really what we want to do is at the earliest stages before the table has even been created to really be working in equal partnership with all the folks who have a vested interest in the work we're doing. And so that's really, a spirit of community engagement that I try to hold with me and invite you all to consider in your work. So Savvy and I are going to be sharing some information from the Inspire Project, and then I'm going to try to talk through fairly quickly and keep an eye on the time a little bit because I'd love to just have some like open conversation at the end, questions, but also just like hear reactions from you all, hear additional points that you want to bring up, and we'll note, I know there's at least a few other Inspire partners in the room, so I really welcome you all to jump in as we go or at the end if there's anything you want to add. So to start us off, I'm going to start at like a very, very basic place, which is just some definitions for what we're even talking about. And I think that in general, there's a lot of assuming we sometimes do that our intended meaning is the same meaning that folks receive when we say things. And that we would all maybe do a little bit better to really be thoughtful in defining and being clear about when we're talking about something, what this really means to us. And I think one of the things that I have absolutely experienced doing community engagement work and has really been reinforced with my experience in the Inspire Project over the last year is that we are not on the same page about what we mean by community or what we mean by community engagement. And it's such a foundational but really important place for us to start our work and how we think about advancing community engagement and community partnerships. So when we think about the word community, which gets used a lot these days, I think there's three kind of big buckets that we can think about who community is. So the first is folks who share a geographic area. So people in your neighborhood, people in your town, people in your region, maybe folks in your state. If you're coming from an organizational perspective, maybe you're thinking about like folks who are in the catchment area or the service area of the health system or a hospital. And different geographies, how much folks within that geography have in common varies a lot, right? Like people in your neighborhood, maybe you have a lot in common with. People in your county, maybe less so. The second big bucket of like who community is at an individual level are folks who have shared identity or shared experiences. And so this can look like the trans community, people who have diabetes, people who have immigrated to the US. Of course, there's overlap sometimes between folks that we have these like shared identity, shared experiences with, and people who live in our same geography. So this might look like folks you go to church with, people on your softball league, your actual, friends and family. And so on the top half of this diagram are what we often talk about in the Inspire Project is people with lived experience. And sometimes we also see words like consumer, community member, community resident, patient, plan member, et cetera. But this is really talking about the folks who, at an individual level, share something in common. Then at the bottom half of this diagram is the other big way that we hear community being used, particularly in the context of like healthcare organizations, is where they're thinking about other organizations who maybe share their geography, are working to serve the same population or same group of individuals. And this to me is like a very broad category. I mean, you know, sometimes when we hear organizations talk about community in terms of other organizational partnerships, they're including community-based organizations, other healthcare organizations, the private sector, public agencies. It's a really, really broad group. And even for the group within that, that's called community-based organizations, we know that what that means varies a lot. There's some community-based organizations like the one that Savvy runs, you know, that's led by a person with lived experience that's rooted in the community. And there's some organizations that are just a 9 to 5 in the community, you know, and the folks who work there don't necessarily share the experiences of the folks who live there. They can't necessarily speak with the voice of individuals. And so all community engagement, in my humble opinion, is good and noble work. But the difference between building partnerships with individuals with lived experience and organizations building partnerships with organizations is very different. The process is different in different ways. The aims are different in many ways. And the outcomes are different in a lot of ways. And so I don't know what the solution to this is. I had someone ask me this recently, like, what should we call, you know, partnerships between organizations, if not community engagement? I don't know the answer. If you want to throw an answer into the chat, the Inspire Project might run with it. But in the meantime, I think, you know, one remedy is just to be specific and to be clear as we're talking about community engagement, what we really mean. So in terms of community engagement, if you can Google what is community engagement, you will get many definitions. The CDC, Center for Disease Control and Prevention, has a definition. The World Health Organization has a definition, but the Inspire team felt it was really important for us also to create a definition, which we have here on the slide. So for our purposes, community engagement is the different ways in which healthcare organizations reach out to, engage, and partner with people with lived experience with the goal of working together to improve healthcare and achieve positive health outcomes. And there's two things about our definition I want to point out. The first is in terms of the Inspire Project and what we're focused on, we're really interested in the top half of that previous diagram. We're really focused on how organizations can meaningfully partner with and engage people with lived experience, not the organizational partnership component of community engagement. So our definition speaks to that. And then the other thing we wanted to do is just create a definition that's hopefully in plain language and it's like easy for lots of different folks to understand. And then the last thing I'll say just in terms of defining community and community engagement is that overwhelmingly, you know, one of the kind of takeaways we have from the Inspire work, and I think an experience that I know will resonate with a lot of people, is that for many healthcare organizations, one of the things that we know is true about the current state of community engagement is that many organizations are prioritizing or spending most of their time on partnerships with other organizations. So the bottom half of this diagram, it's less common that organizations are prioritizing or spending most of their time on the top half, which is partnering directly with individuals who are directly impacted by the work they're doing. And so that's it's the focus of our project to advance that, and also I think a really significant gap in how community engagement happens. Savvy, is there anything you want to add to this point? I warned you I was going to ask that from time to time, so feel free to jump in and totally okay if not.
No, I just think I totally agree. That's really a significant difference, is that we are, our community engagement is very inclusive and aware and communicative with people who have lived experience. So those who are out there that are actually experiencing that contact with all those other communities are very important to what we do in our work.
Thank you. So the last definitional piece before we kind of like jump into the meat of things here is, what does community engagement look like? So I love this. This is called the spectrum of community engagement. There's like a few versions of this framework out there. I can't, the Zoom box thing is not going to allow me to do a good, like, read the room, just ask if this is familiar to folks. I like to do that. And usually it's like I don't know, less than 10% of people who have seen this, but this is a good crowd. So maybe it's more familiar here. But I think this is so helpful for folks who are just trying to unpack, like, what does community engagement really mean for, like, me? And all of these spectrum models, including this one, moving from the left-hand side, where community engagement activities are like a pretty light touch, like maybe like a one-directional, like an organization is out at a health fair providing pamphlets, being like, we're here, we do these, we provide these services, just letting folks know what's going on, to kind of time-limited transactional types of engagement, like surveys, one-time focus groups, and then moving towards the right-hand side, where we have partnership work, folks being embedded on project teams, sitting on advisory boards, all the way up to the far right-hand side, which is work that's like led by the community itself, or as this diagram says, consumer-led work. And that really means that, like, folks have decision-making power. Folks are deciding what the priorities are. Folks are carrying out the work. Folks are being able to actually move and allocate resources. And community engagement can happen in all different ways across the spectrum. And I personally, I don't ascribe a value judgment to the left or right side. Like, I don't think the left side is like bad and wrong. And I don't think the right side is the right approach for every initiative. I really think that good community engagement includes a variety of activities from across the spectrum. Just acknowledging that people, can and want to and have the ability and time to engage in different ways. Not everyone has the time to, sit on an ongoing project board. Not everyone wants to just respond to an online survey. And so really, to think about community engagement options that live across the spectrum, and to also acknowledge that the right-hand side takes like more time and more resources and more trust. And so sometimes starting on the left-hand side to build relationships, to build trust, to start some work is actually a good approach to be moving towards to a more diverse set of strategies for how organizations work with folks with lived experience. All right, so what is the Inspire Project? There's Naomi's beautiful smiling face in the very front of this picture. So the Inspire team is made up of 5 national organizations: the Camden Coalition, Community Catalyst, Center to Advance Consumer Partnership, our lovely host, PFCC Partners, and the Institute for Patient and Family Centered Care. And the other half of our project core team are 6 individuals with lived experience: Rebecca Esparza, Bert Push, Lorraine Cantley, Stephanie Burdick, Carlos Benavides, and Savvy, who's here with us today. And the Inspire team, our core team is both the folks who are carrying out the different activities we're going to talk through over the past year. That includes a bunch of research and strategic planning. And really, this body has also kind of acted as a strategic oversight for the entire project, bringing all the different threads of the work that we've been carrying out in smaller groups together to be a cohesive whole. And about a year ago, the real seed of the Inspire Project was many of the individuals and folks and organizations on the core team all had this shared experience that over the past several years, healthcare, and I would say other sectors as well, are really increasingly interested in this thing called community engagement. When I started at the coalition in 2019, folks were not generally bought in. You spend a lot of time on the why community engagement matters, why you should do it. And over, the past couple of years, people are like, yes, we should be doing community engagement, or we are, or we know we should be. And although interest is really high, we've, I think, all experienced that there's real gaps around the how. So community engagement is the right thing to do, but how do you actually operationalize it? What does that look like? How do you build trust with people? What does it mean to share power? All of those, like day-to-day, like how that actually translates into people's work. There's a lot of uncertainty there. And so the Inspire team came together to say, we want to, number one, really spend some time understanding what is the current state of community engagement across the US and the healthcare system. Secondly, what is the ideal state? Like, how do we imagine that, both from the perspective of organizations and from this perspective of community? What do we want to be working towards? And then to create a roadmap to help us move from where we currently are to where we want to be. And so over the past year, we've undertaken a variety of research and listening activities. We've heard from over 300 people across the country, which includes folks who work in healthcare roles, as well as people with lived experience to inform this process. And I'm going to hand it over to Savvy, who's going to talk a little bit more about how the Inspire team, how we also really, endeavor to ensure that our project process reflected some of our values around inclusion.
Thank you, Evelyn. And if anyone joined in, just reintroducing myself. My name is Savvy Makalena, and of course, I am the founder of Give Me a Break, which is a nonprofit organization caring for caregivers. I also serve as the vice president on the Hawaii Family Caregiver Coalition board. But most importantly, I am a person with lived experience, having been a caregiver and still a caregiver myself. So I'm really honored to be part of the Inspire team, representing a community of caregivers. And I think that that's one of the most important parts of what we are doing for me, because caregivers don't always have a voice. And especially even those with people with lived experience who are going through any kind of health situation, you don't always have a voice that can speak for you. So knowing that that happens. But we've really created a variety of ways for the people with lived experience to participate. In fact, the Inspire listening session that we have done, which have been led by the Camden Coalition and the Community Catalyst staff, and some of those that were pictured earlier in the previous slide, Bert Push, Carlos Benavides, and myself, worked as a team collaboratively to identify appropriate forums and goals for each listening session, and then develop discussion guides to facilitate these sessions. So really, all together as a team, the investment for resources and to providing training and skills and building opportunities for all core team members was met. And I think it's really interesting too that in these interviews, we're not just with, and I think you might be touching on this later, so I don't want to, but they were conducted with a total of 21 virtual interviews, and 9 of which were with people with lived experience. 12 were with healthcare stakeholders. So there was a really nice balance of communicating with everyone, and definitely a collaboration with the entire team to be able to do this. Did I miss anything? I think I did.
Trying to find my unmute button. No, that was great, Debbie. Anything else you want to add there, or?
No, just I think I missed that last point about the recruit participants for various activities. We sent out emails. And so I think that everything on this slide helps everyone to understand that we tried to cover every possible base of communication, and to be able to really get an understanding of what is out there as far as people with lived experience. So, and I sincerely appreciated it. So thank you.
Thank you. Yeah, thank you, Savvy. And just I'll add one thing to the last point here. I think one of the things we hear a lot when, folks are maybe in very early stages, folks in organizations are in early stages about thinking about community engagement is like, oh, it's like so hard to find people. Like, we don't want to ask people. They have so much going on. And, how do you find people with lived experience? Like questions like this. I'll say this interest form we sent out to just like a couple groups within our immediate teams networks. We had over 100 people respond to it within a couple of weeks. Folks with lived experience who wanted to be part of this work, who wanted to take part of the project. And so I also I want us all to know that. And so when people say like, we can't find people or we don't want to burden people, it's okay to ask, and folks are really interested in coming to the table, is our experience. So I'm going to touch briefly on some of the key findings from the research work that we did over the past year. Our final report is going to be coming out later this summer in late June or early July. So we I'd love to say we are community engagement people, so we will keep in touch with you. If you want to receive a copy of this report, don't you worry, you do not have to find us. We will be happy to send it your way. So I'm not going to go in full detail here, but just to tee up a little bit of what we've learned. So the first big finding is really confirming our project hypothesis. which is in fact, yes, there's a lot of interest in healthcare to engage in community, to engage with community, even though we're not always on the same page about what that really means. And we're certainly not on the same page with what that looks like. In one of the project listening sessions, a person with lived experience said healthcare organizations are catching up to where the community has been for years, which I just love. And I think, what she meant by that was in terms of like wanting to come to the table together, and really understanding that there's value in partnership work. Organizations are catching up to where folks with lived experience have been for a long time. And alongside that, there's several places where implementation of community engagement is really limited. And so there's a few specific areas that we heard a lot about. So number one is that there's really not consistent infrastructure for how organizations structure their community engagement work. So we did a field survey, and the majority of people who responded to the survey and said that they do community engagement did not have community engagement activities as part of their job description. Many people are doing it as like a secondary role, or it's something that's just getting kind of tacked onto their work, maybe because they like live in the community, maybe because they're a community health worker, maybe it's because it's something they have an interest in, but it's not like structurally supported in terms of people's roles. And alongside that, people aren't necessarily receiving any sort of training or support or any of the things that we know help people in professional roles be successful at carrying out the activities they're responsible for. The other piece of that is that across a healthcare organization, community engagement is happening in all different types of teams and departments. So there's pieces of what I would call community engagement that live on that spectrum that are happening under health equity. There's pieces that are happening under community health or population health programs. There's pieces that are happening under marketing and patient services. And very often those teams aren't even communicating or coordinating because there's not this shared sense of what we're all doing is community engagement. And just a brief anecdote I'll share that I think really illustrates that is I'm friendly with a lady who's the director of community engagement for a local health system here in New Jersey. I also happen to be a patient of that health system. And so I get all these surveys from them, which are called Patient Voice Activated, which I think is like a very catchy name. And obviously I fill out like all of these surveys like extremely diligently. And so I was talking to this lady and asking her, what do you all do with this information? I've never received any sort of, feedback about what, if anything, was integrated, what, if anything's done, which is definitely, I think a very common gap, but just like a lack of closing the loop with people. And she said, my department doesn't receive that data. It goes to our marketing department and they don't share it with us. And that to me, like, is really emblematic of like, where a lot of organizations are, where like the dots are not being connected. Two other gaps I'll mention quickly. One is around diversity and representation. So community engagement work right now is not, in many, many instances, is not representative of who's actually in the community. So who's showing up skews white, skews older, skews higher income, higher level of education. And we're really missing out on many of the exact people that we most need to be part of this work, because they are the ones that currently the systems are serving the least well. But community engagement is not reaching all those voices. And on the healthcare organization side, folks talked about this a lot as people being hard to engage. And on the community side, for folks with lived experience, people talked about this as healthcare organizations not removing barriers effectively so that people could participate. And so I, of course, agree with, kind of the latter way of thinking about this. And so there's a lot of work to be done to really meet folks where they are. And then the last thing I'll mention is just that right now, community engagement activities aren't always connected to impact. So the PFAC is meeting, Patient Family Advisory Committee, they're meeting. The community board is meeting, the surveys are going out, but healthcare organizations aren't always doing enough to ensure that the way people are contributing information is actually connected to their ability to act on that. They're not always ensuring that folks with lived experience are actually integrated into the different department teams or project teams where their input could be influential in real-time decision-making, nor are they always taking the opportunity to bring folks who are actually making real-time decisions to their existing bodies like the PFAC or whoever is writing these surveys that I'm so diligently responding to. And so there's a lot of opportunity to really think about, like, community engagement isn't just happening to happen, but it's because it is really informing in real time, and we're really seeing it as a quality improvement activity. The second finding is that both from the community side and from the healthcare practitioner side, people really want more support to do this work well. And I actually think this is really significant, because it is possible that like things aren't going great, but everyone's like, this is fine, you know, and there's not really a desire to do anything differently. But both from folks in healthcare and from community, we heard a lot of the same things, which is no one's ever trained me to do this work. I feel like I'm making this up as I go along. I'm trying to bring other people into this work, but I don't really know how I'm supposed to do that. And so I think there's such a great opportunity, and you know, certainly groups like PFCC Partners and the PFA Network are tackling a piece of this, you know, providing peer communities, providing training to support folks with lived experience in building your skills and your awareness of how to be effective in advocacy and advising roles. We need more of that. It's not reaching everyone who's interested in that, of course. You know, there's lots of opportunity to build that out. And then also on the side for folks who work in healthcare organizations, there's tons of interest. Folks are saying, I wish there was more forums where I could come together with other people doing this work, learn from what's going well in their communities. I wish there were more best practices. I wish there was tools that really helped me implement. There's a ton of community engagement resources out there, but I know the ones I'm familiar with, a lot of them are at a conceptual level. They talk about concepts like trust. They talk about concepts like accessibility. They don't always get to the level that they can really help folks understand step by step, how do I operationalize that in my work? And don't always provide the level of support people really need in turning a good idea into action in their day-to-day. So the third big finding is that despite, you know, the fact that there's a lot of opportunity to strengthen the work, there's so many ways that people are finding value. And I'll just touch on a few of these. So number one is that many healthcare organizations understand that community engagement is an essential aspect to addressing health equity, that the only way to address and ultimately eliminate health disparities is to partner with and listen to the people who are experiencing those disparities, and really centering the people who are impacted by poor health outcomes in the process of understanding the problem and crafting the solution. Many organizations also talk to us about how community engagement helps them to be more efficient and effective and targeted, and where they put their money. Like many people said directly, you know, it helps us not go down the wrong road. We know what people need. We know what will work for folks. And a way to think about this is like the opportunity cost. So it takes a lot of time and money to create something that doesn't meet the need, that people don't like, that doesn't work for folks. And I think, you know, if you're in a program design role, you've probably lived that experience where you can just spend a long time going down a road that is like not right. And then you think, if only I had known this one thing earlier on, we could have just taken a completely different course. And that's really what community engagement can do. And then the third and last dimension of value that I'll talk about here, although there's a few others that we talk about in our report, which is, I think, maybe my favorite finding from our work, is that part of the value folks take from community engagement is about connection and about well-being, both as an outcome and as part of the process. And interestingly, this was another place that folks who work in healthcare and community were telling us very similar things. So on the healthcare side, we heard a lot of people say that community engagement work feels good, you know, especially for providers and clinicians that are often really stuck in this difficult, you know, time limited, transactional clinical encounter, you know, fast paced type of role. Community engagement is an opportunity to step out of that, to build relationships, and to really connect back to the reason they might have gone into a helping profession to begin with, which is that they care about people and they want to help. And community engagement provides in many ways just a better context for them to do that and feel like they're making a difference and that they're able to get to know people. In our literature analysis, there was also some literature that backed this up, that in being involved in community engagement for healthcare professionals helped to reduce burnout and help to increase retention. And we know that like workforce and issues around, you know, the challenges that the especially frontline healthcare providers are having right now is really significant. And so community engagement can also be a way to help organizations think about retaining staff and increasing their well-being and satisfaction. And then I think less surprisingly on the community side, we heard a lot of the same things. For many people with lived experience who do this work, and I'm sure this will resonate with, folks here, oftentimes it's because people had a really bad experience and want to transform their own challenge and struggles into an easier road ahead for other people. So it's really a healing process. Many people, identify that social connections and meeting other folks is a key reason that they enjoy being part of community engagement initiatives. And then one thing that actually our Inspire team has talked a lot about is that just the process of being with people you really like, working together, being focused on relationships, there's a lot of healing properties in the process of the work as you're also working towards improved health outcomes as an outcome of the work. So I just think that theme around well-being and connection is beautiful. And then lastly, also not surprisingly, is that structural and policy factors impact the adoption of CE, which probably for most things, structural and policy factors impact the adoption of many things. So no exception here. And so just a couple examples of this is that, there's policy options. Not only can we think about supporting folks who are doing the work day to day, but there's examples like the relatively new CMS final rule that requires D-SNP plans for people who are eligible for both Medicare and Medicaid to have enrollee advisory committees. The state of Massachusetts has a requirement for hospitals to maintain a patient family advisory committee. So policy is a way to ensure that community engagement happens. Doesn't always address whether it's happening well, but certainly it ensures that first step of like it has to happen is in place. And there's lots of opportunities through policy also to strengthen some of that. So to increase requirements around diversity, around reporting, so much opportunity around community benefit spending, which is provision in the Affordable Care Act to ensure that some of the nonprofit health systems put certain amount of money towards the community, but the way that's written is like very vague, and there's tons of opportunity there to make that as it plays out, like more true to what I think a lot of us would say was like the intention behind that policy. And then the last piece here is also thinking about how we measure community engagement, how we understand impact, and how we're able to create a sense of like, we know what good really looks like, we can measure it. And then importantly for healthcare organizations, we can understand what the business case is, what the, kind of financial value attached to community engagement might be, which I know for the Inspire team is always like we kind of like grapple with it because we don't want to say community engagement is just about money and just about financial return on investment. And we know that for a lot of healthcare organizations, like that is a big piece of how they are making decisions. So that was okay. That was like a whirlwind of our findings. And I'm going to try to move us along briefly because I do want to have some time to chat. Savvy, is there anything you want to add to those findings before I keep us rolling?
No, I think you covered it phenomenally well, considering how much there is. So I encourage all of you to keep an eye out for the final report because there's some really great information in there.
Yes, thank you so much, Savia. Please feel free to read our final report. I'm like, just say the basics, and then I'm still like, oh my gosh, I've been talking so long at this point. So the last piece of the presentation that I think we'll go through rather quickly, we do also have a brief that the Inspire team put out called the 9 dimensions of authentic community engagement. So you can read more from this next section in that brief. But another question our team really grappled with is like, what makes community engagement good? Like, how do you know? And so in the early part of our team convening, we engaged in a series of facilitated conversations that served a few purposes. One was like to get to know folks on the team, to understand their backgrounds, their perception of community engagement, their experience, how they come to this work. And one of the things that came out of this process was us really aligning on across the Inspire team what good, or the way we're saying it is authentic community engagement looks like. And we arrived at these 9 dimensions. So authentic community engagement is asset-based, it's diverse and inclusive, it's equitable, it's impactful, it's integrated, it's mutually beneficial, it's resourced and compensated, it's transformational and restorative, and it's trust-based. And it doesn't have to be hard. And that's, I think, another thing, you know, our team really wants to emphasize. I think sometimes people can get like real worked up and technical about things. And sometimes I'm like, I think you can just call folks. Like you can literally just pick up your phone and call folks, and you can be doing authentic community engagement. And I'll also say about these 9 dimensions is that I think you can apply practices from these all across that spectrum. So whether you're thinking about just being at a community health fair, engaging in informing level, you know, the kind of most basic level of engagement, or community-led initiatives, there's ways to do that really well and do those things with these values in mind. So just in the interest of time, I think I'm gonna make an executive decision that we'll just touch on 2 of the 4 slides that we have here. Savvy, do you want to vote on which of the 4? If you remember, I'm really putting you on the spot here, but any particular one you want to make sure we cover in the next couple minutes? You can also say that's not a fair question and make me pick, and that's okay.
I was looking for my mute button. I apologize. That whole 2-screen thing with the mouse, if you know, you know. But yeah, I actually just really feel strongly about the first 2, the
Okay.
impactful and then the mutually beneficial, just because I think that they sort of summarize everything, but you can do what you want.
I'm gonna do what you tell me, Savvy. So we're gonna just touch on these 2, and I really encourage you all to check out our brief if you would like, because they go through each of these dimensions. But just to talk a little bit about what this means, like at a concept level, and then in our brief we do the same thing and provide a couple really actionable steps. So in terms of authentic community engagement being impactful, real simple, it means it makes a difference. Like it actually does something. We don't just do it to do it, but we actually understand from an organizational perspective and from the community's perspective what our work together is creating. And so a couple of approaches to really like operationalize this, like how do you do this? Number 1 is to utilize assessment tools. There's an incredible project that the National Academy of Medicine convened over the past several years called the Assessing Meaningful Community Engagement model. They have a conceptual model this group put out. They also have a collection of measurement instruments. So like ways to, within a community engagement initiative, understand what's the impact. A lot of the tools consider both from the perspective of the organization side and from the perspective of the community or folks with lived experience. So it's linked here. We'll send out the slide, also linked in our brief. I would say check those out. If you're not at the level of being like, we can use some scientific tool to measure our work, sometimes this also just looks like checking in, like just taking a pause to say, how's this going? How does everyone feel about our process? What could we be doing better? And let's just do a minute to like take an inventory of like how this work together has made a difference, and just being intentional about understanding what the impact is. And the second piece is really around, you know, integrating community engagement as a quality improvement strategy. And so this, I think, relates to what I had talked about earlier, where community engagement is not best as its own separate siloed work stream. It's really best when it's a tool that organizations are applying to meet whatever their goal or priority is. And so the second and last one I'll speak to here is mutually beneficial. So if you're like, what is going on with this rhinoceros and bird situation, I'll just briefly explain that and I'm like not a biologist, so I have no business trying to explain things like this, but I am familiar at a very high level with a concept of symbiotic relationships in nature, which is just one of these things as a non-scientific person I've like latched onto, is like, that's so beautiful that the world operates this way. And there's all sorts of symbiotic relationships, which is they're mutually beneficial. So if you don't know, this little bird likes to eat bugs that live on the rhinoceros's skin. So it's like a very easy meal for the bird. The rhinoceros gets skincare in the process. They have this beautiful partnership where they both benefit. And we should endeavor that our community engagement work serves both sides. So organizations more often than not think, at least to some extent, like, how does this benefit me? From the organization side, we don't always take the same intentionality to think, how are the folks who are showing up to work with us, how are they benefiting? And so a couple practices, you know, is number 1 is to invest in personal and professional development. So I know, Savvy, you spoke a little bit about something the Inspire team tried to do. We brought in some trainings that were open to folks, just understanding like, what people are interested in, who they are as a person, and what resources we can bring to support them, even as it goes beyond the specific project we're working on together. And then the second piece is so easy, which is just sharing the outcomes of the work. It's shocking to me in some ways that closing the loop is so often missed. So I think about these surveys that I take from, the health system where I get care. No one's ever told me what they do with this information. And we hear that all the time. And, to be clear, even the Camden Coalition, that's really focused on community engagement, we miss things like this too. We were just talking with some of our care management teams that they had done focus groups. And myself and some of our community engagement colleagues asked, did we ever share back with the folks who participated what we did? And we had not. And so moving forward, now we just have a real easy process where if we engage with folks, we say, would you like to receive a summary of, either the outcomes of this focus group and or what we've done, with the information and or what any limitations have been to us integrating your feedback. And if they say yes, we get to send it their way. And when we've done this in the past, we've also just said hey, if you're curious about this, if you want to talk about it, here's my email, here's my phone number, give me a call. And it's a great way to sometimes just build entire new relationships with folks who initially came in through just a left side of the spectrum, lower end type of activity, but to just extend that open door to say, we're open to keeping the conversation going. So I'm going to skip ahead. If we had unlimited
Before you
time, we
skip ahead
could.
really quickly, Evelyn, I just want
Oh,
to
go for it.
that you have an opportunity to share your voice as well. And you can go onto the Community Catalyst website and actually record your experience. So I'm not sure if we have that link available, but I'm sure we can get it to you.
Yes.
But it's a really great opportunity to let your voice be heard.
Okay, shout out to you, Savvy. That was a perfect plug. Because I was planning to, do you know that I was planning to try to do that and then I was going to forget, and then you just picked up my slack totally seamlessly.
Great minds, great minds.
100%. But we did just drop into the chat a link. So if you would like to contribute your story of what it's been like as a person with lived experience, if that is the role you play doing community engagement work, please submit a short video. I've heard it's extremely easy and fun, and we will help you if you have any questions. So I'm going to stop there. I wish we had more time, but I would love to just get any questions or comments, if that's okay, Naomi.
Absolutely. I have here, if anybody has any questions, if you want to drop them in the chat or raise your hand while I'm scanning the virtual room for that. We did have a couple of questions that came in with the registration. So one is, what is something that you learned that you didn't expect to throughout this project, the Inspire project?
Savvy, you want to start us?
Absolutely. And I'm going to kind of go very simplistic on this one. Being from a little island in the middle of the ocean, we tend to feel very detached from the rest of the world, and that everything problematic is isolated to Hawaii. But what I really loved about this was the community part of it, and it connected community in so many ways. I mean, we're basically coast to coast in the US right now, just between Evelyn and myself. So I think that was a really important understanding, is that you aren't alone and that there is community and that we are here to support one another in that community.
Yeah, I'll say overall, I would characterize our findings as not surprising, but validating. I think a lot of our team felt that, which is a good thing. I mean, we all do community engagement work, so it would have been okay if there was a real curveball, but it's also cool that we were yeah, that is also, that aligns with how I experience it. I think for me, I'll, return to my favorite finding, the one around, well-being and connection. I'm not surprised that folks with lived experience, that's value that they find. I was not expecting for on the healthcare professional side for folks to also identify that this work feels really good, and well-being and connection is value I find in it. I feel that, and I know that 100%. But I just never thought about it in those terms. So I think that was less expected for me.
Thank you. Janice, I see your hand.
Thank you, Naomi, and I really appreciated the overview. I've seen bits and pieces going along, and I'm impressed. So, community, it's interesting how you first defined community, or, you have it in the three circles sort of. And I had mentioned something in chat, it's just another opportunity for people to think about. Because like I've been involved with affordable housing communities for years, local to national, food, food insecurity groups, and I volunteered with transit. So I've sat on advisory boards or, in different capacities in each one of those, which is another community in itself that impacts health. So I just want to add that. And, I encourage a lot of people to be involved. But along those lines, that involvement I would consider. A couple of them were more engagement, for transit, it was more engagement. But with the food and particularly with the housing, I would consider it community advocacy. So I'm just curious how you think about advocacy with the engagement and how, some people identify as advocates, right? Or like instead of LE. So I'm just curious your take on the advocacy aspect of community engagement and what alignments or challenges you might have found.
Great question. Savvy, do you want to jump in, or you want me to start on that one? That's a me start. Okay, feel free to jump in. Well, it's a great question, Janice. I mean, I think that community engagement is so diverse. And one of the things that I struggle with all the time is and Nora, I'm looking at you, I'm calling you out here because, we're on a project, we're working together to think about how some of the building blocks from community organizing pertain to folks who are doing work as healthcare advocates and or advisors. And it's like, even just, I'm like, it's always such a mouthful because I'm like, I don't know, like people think about themselves in all different ways, patient family advisors, community leaders, advocates, like there's just not a neat box to put y'all in. And that's great, and it's hard language wise. And so in the final report, we actually have a little section where we talk about like the historical and social context of community engagement. And it starts with, that's really hard because language is imprecise, which I feel like could be like the title of a lot of the work we do. But I think that things like community organizing, things like advocacy, the positioning of community is often like the leader and outside of the like system of power or like outside of the status quo. And then community engagement and things like being an advisor is often like driven and led by the organization, and also often thinks about community being like part of that inner circle. They're not at odds, they're just different positioning. And I think that, people love to talk about authentic power sharing in terms of community engagement. And to me, part of what that means is that community engagement needs to stop centering organizations as the initiators and the doers and the table makers, and needs to start embracing and recognizing that community can lead its own change, and that like community organizing and advocacy can be just as much about partnership. But we don't always have to create just a pathway for organizations to initiate. So that's like a long and maybe complicated answer to your question, Janice. But yeah, I just think there's lots of orientation, and I don't think advocacy has to be the opposite of advising, but I think sometimes it ends up feeling like it is.
And I just want to say that sometimes it's siloed from the partners that way, right? So when I was talking about housing, I was maybe an advocate, but that's the way I look at it. But truthfully, I sat at the table with, the head of Nordstrom, community members. It was a community partnership, but they, and I was part of the lived experience community there. So yeah, it is different.
Yeah, totally. Savvy, is there anything you want to add? Or Naomi, I saw you unmute. I don't know if you wanted to jump in on that one too.
Go ahead, Savvy, if there was something.
Yeah, I just, because I serve on the coalition board here as well, we do, a lot of advocacy. And I think that with the Inspire Project, developing community first is so important, and understanding that community and getting to the point where if you're politically advocating, that's a whole nother level, right? And I think that what we are doing though is pulling together a community and getting a full understanding of what it is that we would be advocating about if we would advocate, and to go after that. So You can't go into any of that without having a foundation and knowledge, and all of this, especially if you look at the report, really lays a great foundation and validating for all of that. Just the validation that you had mentioned earlier to what we thought we knew. So having a more rounded and fuller understanding is really in that first step as we take steps going into this.
Thank you for that. Rosie, I see your hand. I'm going to come to you in just a second. There was a question that came in that asked, how can leaders be more accountable to community members?
I want all the folks with lived experience who are on this Zoom to put your answer in the chat. I think there's a lot of wisdom in the room. Savvy, do you want to take that one?
Wait, ask that question one more time, Naomi.
What can leaders do to be more accountable? Healthcare leaders do to be more accountable to community members?
Well, define accountability, right? So again, if I'm going to refer to the report just because it's the voice of so many, is understanding, what that accountability is and what they need to be accountable for. And I think that's important, that we all have to understand our own onus, right? What do we as a person with lived experience or as a community member need to be, what do we need to be accountable for? And what does the organization need to be accountable for? And the answer to that is something that we're really trying to pull together right now. I don't think there's a specific one answer, which is why I love that Evelyn asked for everybody to kind of enter your comments. There are so many answers. And just for us as the Inspire Project, trying to understand all of those answers and then find the commonalities to it. So apologies if I didn't give you a direct answer as well, because I don't feel there is a direct answer to that question.
I think you hit the nail on the head. I think it looks different, to different folks. And I think it starts with asking the people you're in partnership with, like, what does accountability look like to you? And again, with just like the challenge we have with language is like, let's unpack accountable. But I love, what folks are putting in the chat, like listen, like keep us informed. Like some of this stuff is like, I think very attainable. People want to know what, if anything, you've done with my time and expertise that I've given you. Like, if I want to understand, if I told you something, what did that happen? And if not, why? And like what I hear from folks with lived experience all the time is like, we get it. Like, you, just because I say something, just because I have an idea, doesn't mean that you just snap your fingers and it happens. Like, we understand the context of like external constraints and lots of different opinions, but just tell us what the reason is with like honesty and transparency. And so I encourage folks with lived experience, keep dropping your answers in the chat for how organizations can be accountable. I think there's a number of really, really actionable steps.
I know we have a couple more questions that have come in, and I know we are at 4 o'clock, and I want to be respectful of everyone's time. Rosie, are you able to drop your question into the chat?
It was a question anyway, so I will just let it
Okay.
go.
Okay. Thank you. I hate doing that, but I know we have some that are on the time constraints. There are a couple of questions that are in the chat and that came in that haven't been answered yet, but I will send them to Evelyn and Savvy and get the responses and send that out in our follow-up. That will happen. That'll go out later next week. So thank you everyone for joining us. If you haven't already subscribed to our YouTube channel, you can subscribe at PFCC Partners is our channel, and that will be sent out as well. Y'all have a very safe weekend, and we will see you next month. Thank you.
Thank you.